Amid the ongoing fight against the COVID-19 epidemic in China, neighboring Japan has witnessed a leap in confirmed cases, and South Korea has raised its virus alert to the highest level. How serious are the epidemic situations in South Korea and Japan? How can China help its neighboring countries? And how can the three countries work together to resist common threats? To discuss these issues and more, I'm pleased to be joined via satellite by Professor Keiji Fukuda, Director and Clinical Professor from the School of Public Health at the University of Hong Kong and former Assistant Director General for Health Security at WHO Geneva. Dr. Alice Hun-Yang Tan, internist at Miss Maddie Women's Hospital, and Joseph Kim, CGTN correspondent in Seoul, ROK, and via Skype by Professor Xue Lan, Dean of Schwarzman College at Tsinghua University. That's our topic. This is a dialogue. I'm Yang Rui. Hi, Professor Xue. At present, China, Japan, and South Korea are facing the COVID-19 threat together. In what areas is it most important for the three governments to cooperate in the fight?
I think, first of all, I think there are many things that actually these three governments can do. The first, I think, and most important of all, is to share information about the characteristics of the virus. I think China, over the last few months, have been fighting with the virus, and we've learned a lot about the the characteristics of the virus and also how to treat it. I think those information are very valuable, and they actually was, I think, based on many human life sacrifice. So I think those information will be very valuable for our colleagues in Japan and in Korea in their fight with the virus. So I think that's probably the first thing. The second thing is also about how to contain the spread of the virus. I think, of course, while the different countries may have different systems in how to cope with that, but I think in terms of what China has learned, from its own effort in controlling that, I think that also be very useful for Japan and Korea to think about how they design their strategy in addressing this.
Yes, indeed, the three countries in Northeast Asia are common stakeholders in the same boat. Let me go to our CGTN correspondent in ROK. South Korean President Moon Jae-in is in Daegu, the epicenter of an epidemic. He set the country's alert level against the COVID-19 to its highest in response to the confirmation of hundreds of additional confirmed cases over the weekend. What does this highest alert mean in terms of the measures employed to counter the COVID-19 outbreak in South Korea?
Yes, South Korea raising its virus alert level from orange to red, the highest, as you mentioned, is very important because it gives more authority to the central government as well as local municipal powers. For example, it allows the government to have the power to forcibly prevent mass gatherings or close public facilities such as schools or government buildings. And this allows for the government to really use that power in order to isolate as well as contain the spread of the virus so that it doesn't go and circulate in the local population as we've been seeing in this 1 week in South Korea. So this is what the power and authority of the alert level does, and we're also seeing that it's helping to also draw extra budget measures, which is very important in a time of crisis right now in South Korea.
Earlier, I was discussing the issue of how to contain the spread of the virus, and you were also talking about this, taking Wuhan and Hubei as an example. Joseph, human-to-human infections have been proved true. But ironically, and I think it's a brutal fact, on February the 22nd, many people in your country took part in a demonstration at the Gwanghwamun Plaza in central Seoul, despite the government's ban on rallies at three major public squares in the city center to fight the spread of coronavirus. Is the population taking the threat very seriously enough? And how are South Koreans generally responding to the epidemic?
Yes, well, we we should note that the virus alert level was at orange when those mass demonstrations did happen. And we should also note that those were of a select group who were protesting against President Moon Jae-in, whereas the rest of the public, if we look at the responses not only online, but in the general atmosphere of the country, we're seeing that many are cooperating and trying to help the government with its coordinated response in trying to contain this spread. If we see online, not only are hashtags and certain trends following this COVID-19 situation, but we also see cities such as the southeastern part of the country, Daegu as well as Gyeongbuk province, completely empty out since the government has recommended to stay indoors. Now, this is very important, as we've seen in China, that people do not come into contact with one another if they are sick. So it does seem that the public is very concerned with this issue, and it does seem that South Korea is also doing its best to ensure that they do prevent the spread from further happening in the country.
As South Korea has a very different political system, certainly radically different from that in China, we are wondering aloud if our successful experiences could be copied easily by a neighboring country of ROK, taking the cluster quarantine as an example. It could be very difficult. More than half of the coronavirus infections in South Korea are linked to the homegrown religious group of Shincheonji. What are the challenges in tracing the members for various tests?
Yes, as you said, it's been a very difficult task for the South Korean government to try and make sure that they do isolate certain regions. However, we're seeing also in response to this, the government step up efforts. On Tuesday, it was announced that they would take maximum quarantine steps in that southeastern part, which is where the main infection of the Shincheonji branch has come from. So it does look as though the government is trying to do its best to contain that situation, as well as those areas where those clusters have formed. But similar to that, there also does need to be public cooperation, such as Shincheonji. They do need to cooperate with the South Korean government, such as giving information about certain members who attended certain services, or other religious groups, as well as other groups that have perhaps gathered in masses in recent weeks, to ensure that this spread is contained at a fast time so that the government can do its job.
Despite the latest presidential decree, Joseph, let me go back to Joseph again. Despite the latest announcement by President Moon Jae-in to raise the level of alert to the highest, how far is South Korea away from locking down the whole city, yet another epicenter of COVID-19 in our neighboring country?
Well, it's too hard to really say exactly, since health experts haven't given their exact opinions. But if we just look at the past 2 days, from Monday to Tuesday, we see that the number of confirmed cases has dropped by a significant number. This doesn't suggest that because of the government's efforts that it has drastically changed in one day. However, I think this does suggest that there are efforts being taken, and they are being put in place in right and useful situations so that the South Korean government can really do something. I think the extra budget, however, is going to be very important, because we're seeing that certain areas do need more attention than others, and to ensure that clusters don't form in other parts of the country, the South Korean government is going to need to ensure that it's able to contain the spread in those specific regions so that it doesn't spread to other parts of the nation.
We understand, Joseph, thank you very much. We understand it's no easy job to declare what amounts to a state of emergency. I mean, I'm talking about locking down a city, the epicenter in ROK. But regarding the effect of China's measures and how other countries should prepare themselves, this is what Dr. Bruce Elwood of the WHO China Joint Team had to say. Let's take a look.
The global community is simply not yet ready in mindset or with the materials to implement the measures that have been employed, the only successful measures we know so far to contain COVID-19 as it has here in China. And they locked down cities of 15 million people for weeks at a time to try and prevent the spread. And now as they've brought down that force of infection, like we talked about here, that has in turn slowed the spread, without a doubt. So the reason it's important that other countries think about this and think about whether they apply something, not necessarily the full lockdowns everywhere needed, but that same rigorous approach, is because they are now the second line of defense before this virus gets into the low-income countries, the countries that are weaker capacity to deal with something like this.
Well, that's the video clip from Dr. Bruce of WHO. Now, let me go to yet another South Korean commentator, Dr. Alice Hyun-Yoon-Tan, who works for a local medical school, hospital in ROK. Hello, Alice. My question is, in China, for example, in the epicenter of Wuhan, many medical workers in the hospital got infected. I wonder how serious are you concerned with this possibility in your country?
Of course, human-to-human transmission with infection of healthcare workers is a huge concern for us. So first of all, we have a screening hotline number. So anyone who suspects that they might have COVID-19, they call this number first, and then they are directed to a screening center which is located outside of hospital walls. Every hospital has a screening procedure in place for anyone entering the hospital. So they are screened for a fever, for respiratory symptoms, for travel history, and they are given a face mask, and they use hand sanitizer at the door. Also, visitors have restricted access to critical care zones now. Designated COVID-19 treatment centers are well aware of the protocols and the use of personal protective equipment, and we have seen 22 cases cured and released, and so we do know that in those centers they have worked. Of course, medical personnel, they are at high risk because they have close and prolonged contact with positive cases, and so we're very grateful to the service and the professionalism of the doctors and nurses at the front line.
Yes, indeed. The many tragic stories in Wuhan, Hubei, and other parts of that province are indeed a wake-up call for our medical workers in the neighboring country of ROK, and very useful lessons. By the way, many Chinese show their gratitude towards the international society, including ROK, for their timely humanitarian relief supplies. And I wonder, at the same time, Alice, are face masks in short supply? What can China do to help our friends in ROK?
That's very generous and kind for you to bring this up. International cooperation is vital, I think, to the management of COVID-19. Face masks are in short supply here. For the general public, I think we still have supplies for our medical personnel in the hospitals. If we ever had a situation where we needed to ask for help from outside countries, I'm sure that we would avail through the WHO.
You know, as I said earlier in my short interview with Joseph, our CGTN correspondent in Seoul, China has a very different political system. Therefore, we are very curious as to why, despite the warning by the ROK government against having, meetings in public places, in crowded places, you have many people taking to the street in demonstration against the government. I mean, that could have enhanced the possibility of human-to-human transmissions of the infections. What do you think of this haunting specter? Alice?
Well, I think the demonstration that you're talking about occurred the day after the crisis alert status was increased. Most Koreans identify and they know that there is a crucial need to unify and comply with the government's recommendations and orders. The demonstrators, I think they are in the minority. And most Koreans now, we are aware that fatalities are happening in our country along with cured cases. And so people realize that we need to move forward with caution and resolve and to comply with the recommendations of the Korean CDC and the government.
Thank you very much, Alice. Let me cross over to Kenji Fukuda. How do you evaluate Dr. Bruce Aylward's words on China's efforts and sacrifice in this battle?
Well, I think it's clear that the effort which has been made in China to reverse this outbreak has been tremendous. I've spent a lot of time in China over years, and I know the amount of dedication and the professionalism of the staff there. But I think that this, the effort made in Hubei and Wuhan and in the other parts of China really has been heroic, and I know a lot of sacrifices have been made.
Kenji, we've heard a lot of stories about the desperation of Diamond Princess cruise ship. What's the latest? Can you brief us on what the Japanese government has done to alleviate our concerns about this cruise ship?
Well, again, like everybody, I'm following the Diamond Princess story from afar, from the media, but it looks like many of the people, the passengers that were on the ship, have been released. Some have gone back to the countries from which they came. Some have been released into Japan. Some remain still in quarantine. And of the people that are on the ship, I think the majority of them are crew members. I don't know, I'm not sure it's clear what the plans are for when they will be able to leave the ship.
The Japanese are known for being able to exercise self-discipline in whatever social crisis, like the devastating earthquake in Kobe. The rest of the world was impressed by the discipline, the ability of the Japanese to restore law and order voluntarily. Rule of law is very impressive. But given the wake-up call in China, we were able to do a lot to, for example, lock down the epicenter of Wuhan. But how far is Japan away from taking extreme measures? I mean, do you think the Japanese are ready to accept harsh, draconian policy options by the Japanese government, like what happened in China? Because we've got to be prepared for the worst-case scenario, right?
Well, I think that the challenge for all countries, and this is a little bit what Dr. Aylward, who was heading the international part of the joint mission to China, was also getting at, is that we have a basic strategy for trying to fight this outbreak right now. And that basic strategy is to try to reduce the number of people who have infection, and so maybe to reduce travel. And then also to try to reduce the chances that somebody who has an infection and can infect others comes in contact with others. So to try to reduce both of those. How that is done, however, the implementation of that is probably going to vary from country to country. As you mentioned, all systems are not the same. So I think the lesson from China for everybody is that that approach can work. Reducing the travel, social distancing, personal hygiene, these things can work. How it will be done in each country, though, is probably going to have to differ. As you mentioned, the Japanese are quite self-disciplined, and so I think that one of the key things for the government to do there is really to tap into that, to reach out to the Japanese population to make them understand why certain activities, why certain restrictions are so important to fight this outbreak, and really to tap into that societal discipline.
Professor Fukuda, you were working for the WHO, and a few weeks ago, the WHO declared public health emergency of international concern. But how far are we from a pandemic?
Well, so the way I try to explain the situation to people is that we can think of this current situation as where we've had a large outbreak, a large epidemic occur in China. And then there have been travelers who have gone to many countries, and they're brought infection to a number of different countries, but we are still looking for clear evidence that the infections are taking off in those countries. And right now, we don't see it convincingly. Of course, we're worried about what's going on in some countries like South Korea, Japan, Italy, Iran, and so on. And we have to really encourage those countries in terms of taking the steps necessary to control it. If it is controlled, I believe that we are going to be something short of a pandemic. But right now it hangs in the balance. It could go either way.
The WHO has coped with Ebola, MERS, H1N1, swine flu, as well as this time around the COVID-19. What are the differences and commonalities that we should look at in terms of dealing with this social crisis? Well, it is a crisis in China, and this kind of alertness is fast rising in our neighboring country of South Korea. Ebola was contained, but it was something near. It was very dangerous, and it killed many people in underdeveloped countries like those in the sub-Saharan region of Africa. What have we learned?
Well, I think that we've learned that each of these outbreaks have features which are distinct and different from others. If we look at the Ebola outbreak recently in West Africa, and then we see the difficulties of fighting Ebola in DRC right now, we can see that those issues of fighting that outbreak were really very difficult in terms of trying to reach populations and to convince them about how that Ebola might be fought there. And that outbreak raised a great deal of fear. And if we go down through all of the major outbreaks in the past 3 decades, we see that all of them have created different kinds of issues. But I believe the more important thing for us to notice and to take into cognizance is that there are common elements to all of them. In between the outbreaks, we don't spend enough time strengthening our health systems, working on the measures which are needed. Many of the things which Professor Xue was mentioning about, that we can strengthen ourselves between the outbreaks. And when the outbreaks occur, we're almost always caught by surprise. And then we adapt. And the countries that can adapt the best are the ones which have the quite strong health systems. And the countries which do the poorest are the ones which have the weakest systems. And so we really need to still spend a lot of time in strengthening those basic health systems. And I hope this is the biggest lesson that we take back from this current outbreak. A country like China has really strengthened much of its health systems, especially since SARS. It's applied that knowledge, it's adapted to the outbreak, and it's shown that it can turn the outbreak around. We need that lesson to be recognized by other countries and applied in them.
President Xi Jinping recently said that China has raised the level of public health concerns to that of national security, and that should, of course, be justified fully. Having said this, we are wondering if there are vaccines for SARS that took place in the year 2003, and I wonder how long will it take for medical workers to develop in their research the therapy or vaccines against COVID-19. As a senior expert who was working for the WHO, in your knowledge, how much time does it take?
Well, I think that we've seen with this current outbreak that the science can move more quickly in the past. And so the time it took to identify the virus, to sequence it, to determine some of its basic characteristics and features was quicker than in the past. But still, it takes probably a year or longer to have a vaccine which is demonstrated to be safe, which is demonstrated to be effective and goes through the right regulatory procedures, and then can be produced in quantity. And I think that one of the lessons that we've learned from in the past is that even if we begin to have vaccine, we're going to run into problems about who's going to get the vaccine first if we need to distribute it worldwide. So I think that producing the vaccine is going to probably still take us a year to have a regulated vaccine. But I think we should use this time to also look ahead. How are we going to make that vaccine available to the people that need them? This was one of the most difficult issues in the 2009 H1N1 influenza pandemic. And I think that if this virus does go ahead to cause a pandemic, and if we do develop a vaccine, we're going to face the very same issues, and we're going to need to figure those things out. We can see this issue coming. We should begin working on it now.
Thank you very much, Professor Fukuda, for briefing us on the hindsight wisdom that we should review concerning Ebola, H1N1, and SARS. Let me go back to Professor Xie Lan of Tsinghua University in China. Since the confirmed cases outside Hubei have dropped to a very happy low, I wouldn't say appallingly low level, is it high time for the rest of the country to consider seriously restoration of the business operations and other economic activities, Professor Xie?
Well, I think that indeed you need to balance the two. On the one hand is the fight with the virus, on the other hand is how do you really restore the normal social and economic activities. I think the government has already issued several policies to try to really give the local government instructions to really to design more precise policy at different localities. So I think that really depending on where how well you have controlled the virus spread, and then how you can sort of get back quickly to the normal social and economic activities. So I think that now it's a very differentiated sort of strategy throughout the China. And so I think that's sort of the overall picture we are now seeing. At the same time that we should keep vigilant about the potential spread and to take precautionary measures. I think both in terms of the the companies and also the commercial business, and to try to continue some of the best practices, but at the same time gradually allowing people to return to the normal. So I think those I think this is probably the most challenging period of time where you have to be very cautious, but at the same time moving gradually towards the normality. So I think that's really a testing period of time.
Thank you very much, Professor Xie, for joining us. And indeed, a lot of thanks go to other guest speakers who join us from Japan and ROK. Despite the territorial disputes and historical understanding about the sensitive issues, the three governments in China, ROK, and Japan should join hands in facing down our common enemy, COVID-19. We are in the same boat, but I don't know whether people around the world, as well as the Chinese here, are fully prepared for a war of attrition. That's indeed a huge challenge lying ahead. Until next time.